terms of services rendered and making of follow-ups to know that some of these cases are well solved and the victims are well satisfied?
Our role at the Secretariat, which means the coordinator of the network against gender-based violence, our role is to facilitate. But really there is someone who is responsible for the day-to-day running of the one-stop center. However, we provide support in terms of logistics, follow-up. We provide fuels to ensure that they can facilitate follow-up and they can also answer to the calls of the victims against gender-based violence. Where need be also, we give them financial support. That means to the victim. So at our level, we facilitate and we make sure that we support them in their day-to-day running of the one-stop center in terms of fuel, in terms of providing clothing, food, and all those things for the victims. We provide that to them.
Deputy Director of Social Welfare, you as the lead facilitator of this training workshop. What is the reason behind organizing such a training social workers on psychosocial issues?
Thank you very much. I think the reason is in 2010, the network against gender-based violence did a death review. And it was realized that there was a gap, and the gap was there were no protocol procedures for supporting gender-based violence victims. So people were just doing what they were doing in different ways. There was no protocol. And the network therefore decided to come up with a guideline, a psychosocial support guideline for victims of gender-based violence. And because the guideline has been developed and is now at an advanced stage of its final draft, it was thought wise that we invite those who are going to implement that guideline to train them on the guideline, but also to get their inputs and comments on the guideline. And that was the main reason why we organized this training, to ensure that they are trained on the psychosocial support guidelines. Yeah, this is the first training ever on this psychosocial support guidelines.
We are part of participants of this training. We listened to your land, interacted, and we were exposed to various disciplines. How well do you intend to disseminate
Thank you very much. Really, it has been a very exciting training, very interactive, and we learned many things as it relates to gender-based violence. And one of the ways that I believe I can transmit this information is one, I need to start from my workplace in the Department of Social Welfare. I want to share with those who are fortunate to be in this workshop, and also being the coordinator for child protection committees within the communities. I also want to use those platforms to ensure that it is part of our sensitization programs to ensure that people are also aware of the consequences and the menace of gender-based violence.
In our last segment, we'll look at women and their reproductive health. Cervical cancer is an alarming disease that affects the lives of women, especially pregnant women. We'll now take a look at what causes cervical cancer or cancer of the cervix. Cervical cancer is malignant neoplasm of the cervical area. It may present with vaginal bleeding, but symptoms may be absent until the cancer is in the advanced stage. Treatment can consist of surgery in the early stage. As we hear more from RVTH Deputy Matron Seni BI.
The problems affecting women in the Gambia. When women are pregnant, there are certain important things that we look at, and those are the diseases that affect women. One of them is in pregnancy-induced hypertension, anemia, and bleeding. When you say bleeding, that bleeding is divided into two. You have APH, bleeding during pregnancy, and then APH, that is bleeding after delivery. Those are the problems that mostly affect women, or women in the unit. And then other problems that affect women also are STIs, fibroids, and then cancers. Like today we are going to look at the cancer of the cervix. That is our main topic today that we are going to look at. Those are the problems that affect women mostly. Why we are looking at cancer? Because we are looking at the incident that number of cancer cases, admission of cancer cases in the world are increasing. So we decided to come up with this problem to talk to people about what is cancer and how cancer is managed. The causes of cancer are unknown, but data have suggested that a strong association between sexual history and practice indicate that cancer of the cervix. In addition, a lifestyle and being identified as a cofactor for development of the disease, like sexual practices associated with an increased risk of cervical cancer, includes onset of sexual intercourse, like before 18 years, or multiple sexual partners. Those indulge in sexual activities at the early age are prone to develop this cancer, and those with multiple sexual partners. Today you are here, tomorrow you are there, day after tomorrow you are there. All those people are prone to this cancer of the cervix. Another is history of infection with STIs. Like if you have these STIs, untreated STIs, can also develop to go into for you to develop CA of the cervix, cancer of the cervix. Other things like cofactor associated with an increased risk induce decreased level of vitamins A and C. If all those things are lacking and folic acid are lacking in your diet, you are likely to develop this cancer of the cervix. And the misuse of tobacco and alcohol abuse are also contributing factors for one to develop this cancer of the cervix.
Higher levels of vegetable consumptions were associated with a 54% decreased risk of HPV persistence.
We can also prevent cancer of the cervix by improving on our diet. The people need to know that they need to have an increased amount of vitamin A, vitamin C, and folic acid in the diet that we would eat. If you recall, the previous Seni has mentioned when he was presenting. So diet is very important. All the same, these things have to come and combine together in order for one to keep yourself away from having cancer in general. But as of now, we are limiting ourselves to cancer of the cervix, since this is women's program.